we're on time. We're going to start the webinar officially right now. So welcome everybody. Very excited to start this session. Today's topic, it's strategies on enhancing financial, medical, and mental health in your organization. We have three amazing panelists for this session from three amazing companies, and I'm very, very excited for everyone to meet them. So to start off, this session is brought to you by Bucketlist Rewards, the #1 employee rewards and recognition platform, and partnering with Advica, supporting employee healthcare needs, Keep Financial, smart compensation for improved engagement and retention, and Greenshield Health, integrated health and benefits. All I can say from this partnership, it's the perfect partners for today's topic. So can't wait to hear from our panelists today. And to start off, quick round of introductions. I'll start myself. I'm a customer success manager here at Bucketlist Rewards. I've been with the company for over a year and a half now. So yeah, I get to have one-on-one with clients, listen to some amazing rewards and recognition experiences, well-being experiences. So yeah, very excited to be here. And I'll pass this on to Kevin first so he can introduce himself.
Great. Thanks, Rodrigo, and welcome everyone. So my name's Kevin Brady. I've been in the employee benefits field for over 30 years. First of all, started with one of North America's largest insurance companies, kind of went through their corporate ranks, and then went out and started my own employee benefits consulting firm in 1998. And through that work, realized that a lot of companies have issues helping their executives and their employees with health. So I actually started a new company called Advica Health, which is what we're here to talk to you about today. And we help people find the very best health solutions and outcomes. And I say people, mainly corporations, executives, and employees.
Amazing. Thanks, Kevin, for sharing that. And I actually had a fun fact about you, Kevin, that you finished 10th in the 2022 World Triathlon. Is that true?
That's
Wow.
right. As a matter of fact.
Wow.
There you go.
Impressive.
Impressive. Amazing. So next would be Debbie. Would you mind introducing yourself?
Absolutely. And hello, everybody. My name is Debbie Garshin, and like it says on the slide, I'm a registered social worker. I have worked frontline in psychotherapy in mental health care for a number of years, probably 15 plus. And as well, I've worked in the employee health and wellness space for over 20 years as well in various capacities, mostly in employee assistance programs, heading up programs. And currently, I'm actually the clinical head for Greenshield Health clinical services, and we do lots of EAP work, benefits, insurance, etc. So happy to be here and talking with you today.
Amazing. Thank you, Debbie.
And I have not done a triathlon, so I salute you, Kevin.
Smart move.
Yeah.
Awesome. And last but not least, Catherine, would you mind introducing yourself?
Sure thing. As it says, co-founder of Keep, we work with employers to create or craft creative compensation options that help attract and retain talent while also helping them with their financial wellness. Our last company was called Cabbage. We worked with small businesses to give them access to financial products and services as well. We sold that company to American Express in 2020. So we have a long history working with small businesses, with business owners, and with our own many employees in the past to help them gain financial, I would say, independence and confidence.
Amazing. Thank you, Catherine. And as I mentioned before, the perfect partnership for this webinar. Really excited to move forward with this. So some housekeeping items for everybody to know. There's a chat box feature available. It's ready for everyone to just pop in the chat any questions or comments you might have. There's also a Q&A. You can put in any questions you want to be answered so we don't lose them. So please feel free to do that. We will be triggering polls. They are all anonymous, but we would love to hear what you think through those polls. So anytime I trigger one of the polls, please just respond to that. And at the end of the session, everybody will be receiving credits, and the session will be recorded, and everything will be sent via email to every registered participant after that. So to start off, and in the spirit of building community, let's kick things off with an icebreaker question for everyone. And please feel free to type in the chat. What are some awesome examples of employee well-being initiatives you've seen in your company and past companies you worked with? And to start off, I just want to share one that we actually have in Bucketlist. We have a Bucketlist benefit, and we get one day off per year, plus an allowance that we could choose for any experience that we want. And I actually used it this year to go to Toronto to see the Niagara Falls. I went there for a full week. Pretty much everything was covered. So an amazing experience. Debbie, Kevin, Catherine, feel free to share. Also, anybody in the webinar, please share your responses in the chat as well.
Oh, I love what's coming in. I would say some of my favorite well-being initiatives are, lunchtime gatherings. We're all remote now, so just some lunchtime informal gatherings, eating lunch together, sometimes some informal yoga stretches in the middle of the day, things of that sort. It just brings everybody together and just gives you a break from, dare I say it, the monotony of work, but it infuses a little bit of fun. And again, those are easy, doesn't cost much, just takes a little bit of time.
That's great, Debbie. Yeah, we do something that's effective is every Monday we have a team check-in. So everybody checks in, and we start the meeting off with something called a positive focus, where everybody has to talk about one positive thing personally that happened over their last week. So it gets everybody in a really good mindset and starts the meeting off very positive, and you learn what's going on in your employees' lives as well.
Mm-hmm.
Nice.
Sure.
We actually had a comment from Priya, a small but very effective, related to what you're mentioning, Kevin, a standing 15-minute meditation session that anyone can join. That's cool. Really good initiative. Yeah. Perfect. So moving on, I know we have a lot to cover today. So we've broken this fireside chat into different parts. To start off, we're gonna setting the stage. How can a culture of health positively impact your organization's bottom line? We're gonna talk about a framework, steps to take for a holistic approach to employee health. We're gonna talk about strategies as well, what strategies that support employee well-being. And then wrapping up, we're gonna share the credits, key takeaways, and have a small session for Q&A at the end. We'd love to hear your questions and your comments. So as I mentioned before, please feel free to type in the chat or the Q&A box as well. First poll for everyone. So to start off, which areas of employee health are being prioritized in your organization? And give me 1 second. I'm going to start this poll question right now. There we go. So everybody should see the poll in front of your screen. So if you don't mind responding to that, I will leave this on for a couple of seconds. I can see, there we go. Awesome. A lot of answers. Wow. Mm-hmm. Amazing. The most popular answers, Debbie, Kevin, and Catherine, if you want to talk about this, mental health, it's the most popular answer right now. Employee engagement as well. Yeah, 73% is mental health for
mm-hmm. Well, that's actually a good sign to see that people are actually putting attention into that. There's been so much attention paid to it. And as we know, events of the world, we just are post-pandemic, we saw a rise in issues. So it's good to see that, workplaces are actually focusing their attention on that, because it's very necessary just to help us all stay and be healthy.
Totally. Yeah, it was mental health, then employee engagement, physical health, and then financial health in the end. And somebody responded also other. Please feel free to share in the chat just for us to know what that other is. Amazing.
Yeah.
So
yeah, I agree with Debbie. Mental health is such a prominent issue right now. And I mean, Debbie knows, being from the insurance industry, the insurance companies have seen a huge surge in disability claims because of mental health, right? So anything we can do as employers to support our employees with those mental health issues so that they can get the care where they need when they need it, which is usually quite quickly, so that they aren't off and they don't go off and, go off on disability and that type of thing.
Totally.
And it stands to reason if their mental health is taken care of and they're mentally feeling well, they can be engaged, right? They can be more present and do better. And we're going to talk about that in a moment.
Perfect. Awesome. So to start off, our first question, what is a culture of health and what does it look like? A culture of health is an organizational framework that promotes and prioritizes physical, mental, and social well-being as a fundamental value and goal for all organizations and workplaces and employees. I'm going to be passing this question first to Catherine from Keep. Catherine, feel free to hop in.
Sure thing. It's interesting. So, running a tech company for the last 15 years, there's a different idea of what culture is, period. We got a lot of questions about our culture. And people always thought it meant that we had like a ping pong table and a keg or something. But, that wasn't what the culture was at all. The culture was a place where people felt comfortable being themselves. And I think that's a really important part of a culture of health, that people can be themselves. They can bring their whole selves to work, which include if they have, if they're stressed out for any reason, if they're feeling, mentally unstable, if they have any sort of physical ailment, whatever the problems are, problems at home, these are all things that are part of what people face every day. What I think is interesting that we never really talked about at our last company, but we realized it after we sold it, was that financial health was actually the foundation upon which it was all built. Because at the end of the day, we all work for money. We all get a paycheck, and that paycheck is what brings us back to work every day. Although we may love the culture, we may love the people, and we may love the work that we do. At the end of the day, we're all getting paid. And so helping people understand how to make the most of that, I think we've realized has been really important. There's tons of data and studies about all of this, but first of all, financial health, financial stress is one of the #1 reasons that people get divorced, or why there's stress in a household, and all of that stress comes back to work with people. And individuals with high financial stress are twice as likely to report poor health overall and 4 times more likely to complain of ailments, according to a recent Forbes study. So I think that financial health is really an important thing, and it starts when the person joins your organization. When they fill out their tax forms, when they determine their, deductions, when they sign up for the 401k and make their investment choices, when they pick their healthcare benefits and decide how much they're going to spend on it, if they are spending. These are all financial decisions that are being made by your employees, and it's really important to help guide them through those processes and make sure that they're doing the best thing they can for themselves. They look to us, surprisingly, for guidance on that, and it's hard to give.
Totally. Thank you for sharing that, Catherine. It's impressive how financial situations can change your perspective and your well-being. Yeah, definitely. Awesome. Passing this to Kevin.
Yeah, sure. So I'll just share my experience. As I mentioned, I've been in the employee benefits world for over 35 years, and what I see as differences, and I really see 2 types of companies or organizations out there. One is one that pays, I'll say, lip service to health of their employees. In other words, they may have an employee benefits plan, but it's more a necessary evil. And the companies or organizations that I see thrive are the ones that make health a strategic priority for the organization. So when you look at their top 5 strategic priorities, often it's revenue and it's profit and trust and other things. But one of their strategic priorities for the successful companies we see is a culture of health within the organization, and then put in the necessary programs to support their employees, whether it's mental health, whether it's physical health, whatever it is. But that's where I see the difference. And so I guess to summarize, the companies that thrive are the ones that make health a strategic priority for their organization.
Amazing. Thank you, Kevin, for sharing that. Before I pass to Debbie, we had a comment from Said. If you have fit and healthy surroundings, then it will definitely help you to improve and take care of your own health. Yeah, thank you for sharing that, Saeed. Debbie?
Absolutely. Yeah. And I'm going to sort of add to that. I mean, when I think of a culture of health, I sort of define it as a culture where well-being thrives across the organization, so that the culture promotes a healthy, equitable place to work. And sort of speaking to this comment, I think about Maslow's hierarchy of needs. So if your basic needs are met as a human being, you're able to build on that. You're able then to become, as they say, more actualized, but you're able to develop and evolve. So I feel like a culture of health is necessary in a workplace in order to meet those basic needs that people have. So Catherine talks about getting money and having a safe place to work and having colleagues that are respectful. So those are the basics, right? And if we have those basics, then we're going to thrive. We're going to do better. We're going to be able to bring our best foot forward. So I think about it also as everyone is free to make choices in their workspace that lead to healthy lifestyles. And if an organization can at least give those basic needs to their employees, then it's fostering this culture of health and wellness. And they're going to do better ultimately, because your employees have those basic needs met, and then they can build on that.
Totally. And I could say in a personal note, like, we're a fully remote company. Having things like a rewards and recognition platform, for example, having that human touch to be able to recognize individuals and also take care of our own well-being, it's very important and actually hard to do with a fully remote company. Yeah. Awesome. So moving on to the next question. Thank you all three for sharing that. Next question. How can building a culture of health impact your organization's bottom line? And to start off, I'll pass this question to Kevin.
Great. Thanks, Rodrigo. We see it time and time again, companies that, again, make health a strategic priority for the organization and then follow that up by putting the right health supports in place. We see over and over again, it directly hits the bottom line through, you think of healthy employees and just think of an organization that you personally love dealing with. They probably have healthy employees. They're probably happy employees, which means they come to work more often. Their absenteeism is a lot less. Companies that focus on culture, they have a reduction in disability costs, a reduction in health costs, and an increase in retention. So it just, we see over and over again, organizations or companies that really pay attention to health of their employees. It goes right to their bottom line.
Right. And just to add on that a little bit, like, it's an employee's market in a way, right? Employees today want to hang their hat at organizations or workplaces that they feel good about being at. And if these things aren't attended to your point, Kevin, like, there's going to be turnover, and that costs the company money. And they're very, thoughtful today. The younger generation really wants their needs tended to. I'm sorry to jump in if I've sort of overstepped here, but just to add to it all, we know that healthy lifestyles, autonomy and self-determination leads to better outcomes altogether at work, which really just equates to, if we feel better, we can function better. And then we're committed because we're in charge of sort of the decisions that we're making at work. So a workplace that's going to contribute to that well-being, to that ability for people to function better, to that ability to make choices about your own destiny and life, is going to retain those employees and have happier employees, and therefore they're going to function better and do better. Being healthier, and whatever that means for those individuals, it really helps employees be present, be engaged at work, and then do better work for the organization. And I know, quite frankly, personally, if I feel supported and I have a psychologically healthy work environment, I'm going to be able to thrive in what I do. I'm going to be able to give more and give back and really work at my, optimal levels.
Great.
So, yeah.
Totally.
Debbie, I love what you said about agency. I think it's so important for employees to feel like they have agency, they have control over their personal lives and their professional lives. And I think that people do better work when they do feel like they have that agency. And obviously I care about financial agency as well, leaving, when those concerns are not at the top of their minds, then they're focused on other things. I think the other thing that culture of health builds is relationships between your people, between your team members, between your employees. And I think when everyone is working together, they all do better work. And a challenge that I think we're facing right now, especially with a lot of remote work, and we are a fully remote company, and that's hard, been hard for me because I'm older and I like to, see people around the office. But I think the challenge is mentorship. So, I think when people are feeling like they're their best selves, they do their best work mentoring other employees, whether they're new to the workforce or not. But folks who are new to the workforce need that mentorship. They need that engagement. They need people to model that behavior. So I'm hoping that we find ways to create those opportunities, even for companies that are remote. But it does start with the culture of health.
Yeah. That's a great point, Catherine. I think so many companies, including ours, and it sounds like all of us are remote, and that's the new world, right? Where we're all operating in remote. So the real question is, how do we support employees in a remote environment, even if it's not remote every day, right? And I believe that's one of the reasons that we've seen a surge in mental health issues, is because people are alone, right? They're working alone. They're working in their own office. They aren't seeing their counterparts, their fellow employees, right? So your point's a great one.
Totally. And based on the comments from all three of you, I actually had a conversation with a friend a couple of days ago, and he's working at a company that the well-being program is not the best. Like, he doesn't feel that well taken care of. And he's a person that would go into every initiative, go into every meeting with the best attitude. And he's not doing that anymore. And I asked him why. And he just told me, I'm just not motivated. Like, I don't feel well. Like, everything we've talked today, that I think summarizes everything on that. Yeah.
Yeah. Great point.
Yeah. Perfect. I know.
Yeah, there was a question from Carla asking, has culture of health replaced culture of safety? So I would say it hasn't replaced it. I think it's a bigger umbrella term, actually, and incorporates a culture of safety, but it goes beyond, and it goes into the aspects that we've been talking about, physical health, financial health, so psychological safety for sure, and physical safety.
Yeah, I would agree.
Awesome. And for everyone watching, if you don't mind also typing the questions in the Q&A box, that way we could take away if we need to gather more information for you, and we'll share afterward and follow up. Excellent. So moving on to our next question, what steps should we take for a holistic approach to health? How can we consider unique organizational needs, accessibility, and improving existing processes and policies? I'm going to start this by handing over to Debbie.
Thank you. So this is a very loaded one, I think. I start off by thinking that we really need to look at it as a strategic plan or initiative, like you would really any other important initiatives in your organization. So you need to commit to making the change. Obviously, it really helps, and it's very important to have senior leadership, executive leadership level commitment, buy-in, commitment to it. So they're committed. And then engage your employees, survey the employees for ideas, right? Don't just guess at what they need. Go to the source. You're going to want to show that you're interested in what their unique needs are, because your employees are going to be made up of very different people. The needs of a young person entering the workforce is very different than someone who's looking to have their last 5 or 10 years or finish their 5 or 10 years. Employees really are the experts in their own lives. So seek their perspectives, get their input. When you're building your benefits plan, when you're building your healthy workplace initiatives, your mental health strategies, involve the people who it's going to support. and offer the kinds of support that the employees are really asking for. First of all, provide decent benefits, because we all know that sometimes some workplaces give the bare minimum, and this does not really attract people in these days and this day and age. And also offering some flexibilities in those benefit packages, because like I said, your employees are not all going to have the same needs as they span the life cycle. And have a way to communicate with leadership as to what they want. Because again, leadership needs to know what the people are saying. And I always have to sort of yell loud and clear, ensuring a psychologically safe work environment so that people feel safe to speak up and share their ideas, and what they need is really important. These are sort of the starting points to start getting an approach in place, building this momentum to change into a healthier workplace. So those are my thoughts.
Awesome. Thank you, Debbie. Passing on to Catherine.
I think the most important thing is to recognize that it evolves. You know, and just reaching back into our last company, which we operated for 13 years, it changed so much over that period of time. What was important to our folks for wellness? It started out with yoga classes and meditation, and then it became supporting our diverse employee group and allowing them to express themselves in lots of different ways, and supporting different organizations within our company, whether it was a group that wanted to participate in the local pride parade, or whether it was people who were looking for flexible work hours so that they could take care of their children. And I think the evolution of it is very important, because as new people enter the workforce and, they simply have different needs, they come to us from a different place. It's important to reevaluate that all the time, and to be open-minded, because a lot of things that we didn't have when we entered the workforce are things that are now table stakes for people entering the workforce today.
Mm-hmm. Good point.
Yeah, communication, I think, and also understanding that things evolve within time very quickly. Awesome. Kevin?
I'm just going to share a story of, because I was thinking of one of our clients who's done an amazing job building a culture of health, and they get the highest ratings on their culture surveys, and very low absenteeism and low disability claims. So I'm just going to share what they do. So this organization has about 6,000 employees, so quite large. So first and foremost, they make health a strategic priority. So if you look at their top 5 priorities, right on their strategic plan, number 1 priority for their organization is the health of their employees. Okay, so that's their number 1 priority. Okay, that in black and white. The second thing is they put the supports in place to back that up. Like it's nice to say that health is a strategic priority, but you need to put the supports in place. So things like flexible benefits plan, health navigation, mental health supports, virtual health supports. So they kind of put their dollars behind their strategic priority, right? And then the third thing they do really well is they communicate it over and over. So the president and CEO has a monthly town hall. Think of this, with 6,000 employees, has a monthly town hall where he reiterates every month that health and the health of their employees and their families is their number 1 priority. And then he brings HR in to reinforce different supports that they have in place. And they do that each and every month. So it's just a formula for success. And it's quite simple: is make it a priority for your organization, put the supports in place, so put the dollars behind it, and communicate it over and over and over. And just to give you an example, that organization at one time had very high disability claims, to the point they could not even get a quote when they went out to the market because their claims were so high. And since they've really put a focus on health, their claims have decreased 92%. Their disability claims. So just a night and day difference over a 5-year period.
Amazing. I would like to know how many companies do put health as a number 1 priority. I don't think, not a lot.
Yeah, it's a great, you know what, because we're a health company, obviously it's our number one priority is the health of our customers and our employees. But you're right. How many have that as a strategic priority would be a great question.
Really.
Perfect. Moving forward, this would be not our last question, almost last question. What are the best ways to get leadership buy-in for building a culture of health? I would think this is a very important one because, yeah, we need leadership buy-in to implement this sort of changes. So to start off, I'll pass this to Kevin.
Yeah, you know, I think it's just, first of all, I'll just say it's common sense, as I think Debbie and Catherine mentioned earlier. I mean, if you look after the health of your employees, they're going to look after the health of your organization, right? Like it's a win-win. You look after their health, they're going to look after the company, the organization, right? So A, it's common sense, but B, I mean, what we do is we just share statistics that we see over and over again. I mean, from our experience, clients that put health as a priority have a 17% overall reduction in disability costs, right? Over a 5-year period, 11% decrease in health costs, and an 8% reduction in absenteeism. So that's what we see over and over again for organizations that pay attention to it.
Awesome.
And I'm going to jump in. Sorry, Catherine. Did you want to go?
No, go ahead.
I was just going to say, you know, share those stats, share the research on the benefits of a culture of health, because again, we do need leadership buy-in to make the change. I said it before, run some company surveys for on the ground feedback, you know, maybe do organizational health checks. And this doesn't just have to be nice to have, but it can go beyond benefits as well. We do a pulse check on employees' health, physical health, and wellness to sort of see what are the areas of vulnerability so that appropriate services can be put into place to help prevent a breakdown of health or wellness, and give them the tools and benefits that they need to keep them on the healthy plus side. Also, training people leaders on mental health and well-being and how important this is, and that the ROI of paying attention here is, you know, is great. It's good. It really does pay to invest in your employees and their wellness. This might require a shift though, because there are a lot of workplaces still that, you know, when I talk to the employees, when I sort of doing psychotherapy work with them, there's a lot of workplaces that don't recognize it. They're stuck really in an old school kind of culture and way of doing things that needs some changing. And that's a tougher one. But, you know, if you can encourage or somehow get your leadership team to get educated, look at the value of doing the work, you know, you might get a little bit further ahead. Also, if you really need some help in terms of changing the culture, because it's not easy, and you know, just knocking on someone's door and saying, hey, by the way, so that it doesn't just happen. It doesn't happen overnight, but getting some outside support, even some consultation work to get the leadership team to recognize the work that needs to be done and have somebody from the outside come in and help, sometimes can have a great impact and really work for the organization. Because sometimes working like the inside, the people have been there forever, it's hard for them to change what they're already doing, and getting a new perspective or an objective view can really help.
I think it's important to bring data to the table to show specifically this is what happened in these specific examples when this type of culture of health existed. And I think it's great to point to best of breed organizations in whatever your industry may be. Just, you know, if there are always companies, you know, up to which we look, other companies, you know, we want to be more like those companies. And if there are programs and activities and behaviors that those companies exhibit that mean that they have higher Glassdoor ratings, they get They win the best places to work awards. Figure out what they're doing. Why are they winning these awards? Why are they doing so well? Why are they so beloved by their employees? And explain, these are programs that are really working in the real world, and we could emulate them and we could have better results if we tried some of these things.
Love that. Yeah.
Yeah, I just had a meeting with a client this morning and asking employees, I think it's been a topic we've been talking about, and they did a annual survey last year. One of the top things that came out of it's people were not being recognized for the work they do. They implemented Bucketlist. This changed all the way completely, and they just recently launched a new survey today, this week, and the new trending topic is employee burnout. So yeah, asking employees is the best way to ensure everything's working internally. And sometimes we forget. Just ask the employee, ask your people.
Yeah.
Perfect. And then moving on, this is our final question. What are some practical and budget-friendly strategies for supporting employee well-being? Ask this to Catherine first.
Honestly, I have to say it's the thing I just said. I think it's practical to not try to boil the ocean. Find a few things that employees want. And the most important thing is utilization. We had all kinds of benefits that nobody used. And I think it's really important to determine what are you offering today that's being used and that's actually achieving the outcomes that you want. And if you can eliminate things that you're spending money on, that leaves more money for things that people actually want to use. And I think I'm not exactly going to answer this question because there's another question I want to answer first. So I'm just going to do that. So I know that's tricky of me. So sorry, but I think it's really, I think it's really important that there are benefits available for everyone. I mentioned earlier what I think is a great benefit is fertility support and parental leave. But what about the people who already had their kids, or what about the people who aren't going to have any kids or aren't going to have them anytime soon? I think it's important to make sure that there's something available for everyone so that people don't feel that they're not getting the benefit of something that could be very expensive for those employees who participate, or even health insurance. So again, I would say find out what people are really using and pare things down and give them the things that are the most effective. That always costs less.
Awesome. Debbie, Kevin, whoever wants to.
Go ahead, Deb.
Absolutely, benefits are essential. Extended health benefits, definitely, without a doubt, that is something that is needed. But in order to support sort of the employee well-being, I would say cater to, again, the needs of your employees. So offering things like some flex hours. I mean, this doesn't cost money for the organization. Flex hours, right? Allow your employees to get other things done perhaps in the day, or tend to their life needs within reason, of course, based on the needs of the business. I mean, employees can't miss meetings or miss out on obligations, appointments, but if they need to run their kid to school and they can take a meeting in another hour with somebody or do their work, maybe outside of 5 o'clock, allow it. If it's not going to hurt you, why not? Because these flex hours and ability to be creative goes a long way. Sometimes even creating no meeting days or no meeting afternoons, so that you're respecting that employee's time to get work done and not continuing to impose more meetings, and then there is no room to actually work. Again, this does not cost any money, but it's a commitment from the organization and, of course, leadership to allow that to happen. And then everybody can follow suit and respect that time. Some places might offer unlimited vacation. If you think about it, people cannot use an unlimited amount. If they are professionals and they're dedicated, they're going to do their work. There's the perception that it's going to be, oh my God, there's so much, how can we do that? But I think really in reality, sometimes they use less. That's what the evidence is sort of showing.
Sure.
I mentioned this already, informal group lunches, make time for employees to connect, be together. Of course, it's optional attendance, but making space, promoting it, encouraging people to go helps. And again, does not cost money. I think also about communication channels. So discussing the non-work stuff. highlights of their day. Kevin mentioned this earlier, a good thing that happened to them, gratitude, sharing pet pictures. These are all fun and, takes the pressure off and de-stresses at times and fosters this engagement and the camaraderie that we don't get being remote and not in the workplace. Informal games, so providing sort of prizes, doesn't have to be monetary prizes, but just games, challenges throughout the organization, throughout teams, because there's pride sometimes in receiving an award or some recognition. And of course, without a doubt, recognition. I have to make a plug here a little bit. We have an initiative where we're putting together a webinar bundle, for example, for 2024 on health and wellness topics. So, that might be a little bit of a budget spend, but, this is something to highlight relevant topics on wellness days and providing something like that for all of your employees to attend. It's just low budget, but it's recognizing their needs. And things like that just splattered in and around, I think, are really great practical ways to being employee-centered. And I'll pass it over to Kevin.
Great. Thanks, Debbie. All great points. And I think I shared with you that I stole your idea of Friday afternoons, no meetings. So I love that one. I'd have to agree. I mean, being in the benefits field, as I said, for so many years, I'm always amazed still in this day, how many companies have one benefits plan, like one size fits all, right? And for no additional cost, companies can put in a partial flex plan where they don't spend any more money, but they're giving employees choice. Because I guarantee you, if I look at, even my adult children or whatever, a 25-year-old doesn't have the same needs as a 55-year-old when it comes to benefits, right? So give them some choice, give them some options. And then, some other budget-friendly things that a lot of companies are engaging now is, first of all, virtual health, right? Where you can, because people are working from home, they want access to medical for them or their families or their kids 24/7. So having access on their phone 24/7 where they can talk to a doctor or a nurse within a minute and get diagnosed, get prescriptions, without taking their child to the walk-in clinic or the emergency or that type of thing. So that in itself is, it's a very small, a lot of companies are actually even giving that away now, but there's very low cost, huge return. Health navigation, which is helping people when they have a health issue get through the system quickly and efficiently, actually putting their arm around that person and helping guide them through the system. And I think, when any of us think of when us or our kids or our families had a health issue, you're nervous, right? There's angst, and where do I go and who do I see? And if I can have someone that's going to actually look out for me and help guide me through the system, that goes a long way. And again, very inexpensive programs. A new trend that we've seen is, access to mental health is an issue. What we're seeing now is mental health on demand, where people need help like now, like not tomorrow or not in a week or 2 weeks or 3 weeks, but I'm in a situation right now where I need to talk to somebody and a licensed like clinician. So again, very super inexpensive, but those programs are out there today. And then, the non-benefits related things and that I love is like the Friday afternoons off that Debbie mentioned. I mentioned the weekly check-in. Someone came up with a great idea, and I'm not sure, Catherine, if it was you or Debbie, but kudos dollars, so allow employees to recognize other employees, right? I'm not sure. Again, I stole that great idea from, but I thought it was a great idea because often as an executive team, as a leadership team, we don't often see the things that others are doing in the organization. So it's a way for employees to recognize other employees. So just a few things off the top of my head.
Awesome.
Yeah.
Thanks.
We do that entirely. The kudos, we do tacos. We acknowledge good work done by our peers, and it's so much fun, actually. And again, it's all eyes on the floor so that little things get acknowledged. And acknowledgement, as I said, recognition sort of reward, like it goes a long way to really improve employee well-being and how much they're appreciated and, you know, feel a part of the group, a part of the greater good. That's all important stuff. And I can't take credit for the Friday afternoons off. I mean, that is my workplace. They've initiated it since I started, and hands down, it's so admirable because it gives us the space and time to finish up our work, tie up loose ends, not make mistakes, careless mistakes by missing out on things. And then we can wrap up and have that weekend off with a clearer conscience and really take care of our other needs. And that's the balance, right? Because we get so little of it these days. So yeah.
I'm a huge fan.
Kudos to them. Yeah.
No meeting Fridays, huge fan.
Right. No meeting Fridays.
Yeah.
And it doesn't mean no work Fridays, right? It's the afternoon off that people respect. They're not going to take up your time. And then you really do get really some good work done.
Totally.
Yeah.
No meeting. How about no meeting weeks?
Yeah. Well, I often would say one day a month, that maybe the whole day, so that you can really focus on your work. But I'll take what I got. Like the afternoons it's blissful. It actually puts you in a better mood, knowing you're going into it, knowing you have that time and space freed up to do your work. Then it just changes the mindset. And, you know, again, how valuable is that for your employees to have that good feeling that they're valued? Yeah.
Meetings are usually to get ideas, to brainstorm, to communicate, but you don't actually get work done in meetings.
Yeah.
So I completely agree with that. And just a final point on this question, from a rewards and recognition standpoint, like our software actually has a section where you can include company-specific items with no or very little financial impact. So for example, pie a manager in the face, push a manager to the pool, free parking for a week. Like those are the things with very little financial impact that you can include in a software like a rewards and recognition platform that are actually really, really popular and that don't cost a lot of money. So yeah, that's another cool strategy.
Yeah.
Awesome. So for today's key takeaways, what I'll be doing is asking each of our amazing panelists here to share one thing they want people to take away. And I'll start by sharing mine, which I think it's been a very trending topic in this discussion today. It's asking people. Like it's a very simple thing to do. Ask your employees, ask your managers, ask your directors, your VPs, your CEO. Sometimes we have huge strategies, huge working sessions to brainstorm something, but the smallest thing, just asking somebody how they're doing, how they're feeling, if they're happy, if they're not, will definitely change the culture within a company, performance, without a doubt. So yeah, that's my key takeaway. Ask your employees. Debbie, want to go next? Kevin, Catherine?
Yeah, I mean, I actually didn't ahead of time really think about this, but I would say, in keeping with what you're talking about, asking people, if I would say as a people leader, you know, be aware of what your employees need. So that, and listen to them, right? And if you're a people leader and you have some influence on the senior leadership, let them know what your people need. But let them know how impactful it is that their decisions and how they conduct themselves has a huge impact on culture, and it makes a difference. It makes a difference for those employees. So, if you're an executive, a senior leader here, take some time to really look at this, and if you can make a difference in your workplace, I think it's going to make a difference to your bottom line. I think you're going to have happier employees do better work, better quality work, and then the numbers speak for themselves. So it's really two things, I guess, as a people leader, to be aware of what your employees need, what's helpful to them, allowing them that space, and then having some influence on leadership to make those changes and kind of lean towards this culture of health?
I'll jump in. I would say if you're a people leader, it's important to get out of your head a little bit, to remember that we're not a focus group of one. It's so hard to remember that people have totally different lives and needs than the ones that we live every day. So it's so easy to think that one size will fit all. And I think along with that, just being flexible and open-minded to things that you would never have imagined in a million years would be an amazing benefit that people would use and love. And just because we may not want to, go rappelling on Friday afternoons, a bunch of other people may think that's an amazing way to stay fit and healthy.
And I'll just say, to finish off, the story I told earlier of the company that does an amazing job building a culture of health is make the health of your employees a strategic priority, right? If you do that, then everything will flow out of that. So make employee health and the health of your employees and health of their families a strategic priority.
Amazing. Thank you for sharing this. And just to summarize for everyone watching this, our key takeaways for this session. First, ask your employees how everything's going, how they're feeling. People leaders allow employees to be able to action changes and how those changes can impact the company. Being flexible and open-minded, and then finally make health a strategic priority within your business. Amazing key takeaways. Thank you for sharing that. Perfect. And now we're almost about to finalize, and I'm going to start this next poll. Give me 1 second. Let me just get this ready. So on a scale of 1 to 10, how valuable was the content in this webinar? I'll start the poll right now. There we go. It's ready to go. So everyone, please feel free to rate the webinar, and I'll leave it on for a couple of seconds. Amazing. A lot of responses. Thank you so much. Gotcha. I'm going to be closing the poll right now. Excellent. And then we just wanted to give everyone a bit more context about Bucketlist and how we can support employee relationships and well-being in your organization. And if you're interested in learning more, let me know in this following poll, which I'm going to enable right now. Give me 1 second. So if you don't mind responding to that, Bucketlist is an employee rewards and recognition platform. Supporting employees is something that's near and very dear to our hearts. Recognition is just not important when it comes to helping people feel engaged and that they belong, no matter what level they sit at in an organization. We know there's added challenges to when it comes to employee engagement, which lots of different generations in the workplace have different interests, needs, and it can be hard to make sure that everyone feels recognized and rewarded in a meaningful way. Perfect. Thank you for the responses. And then I'm going to pass this to Kevin to talk a little bit about Advica.
Yeah, so we, as I mentioned, our company specializes in health navigation. So we help people get through the system, employees and executive groups get through this health system quickly and efficiently. So our offer is, if you'd like to have a call, book a complimentary demo. We'd love to show you what we do and how we help companies create a successful culture of health, which we do over and over again. And again, we have different programs, one aimed at employees and one aimed at executives. And we also have an offer for a discounted monthly rate for what we call our Gold program, which is our kind of highest end program for executives.
Amazing. Thank you, Kevin. And now I'm going to pass this on to Catherine.
We would love to talk to anyone who's interested in using compensation to get more value out of your people and out of the money you're already spending. So we work with all kinds of employers, especially in the healthcare arena, but all around the country, and every type of industry, to again give employees access to compensation that creates engagement and retention and allows you to attract new employees more easily with the same money you're already spending.
That's great.
Thank you, Catherine. And last but not least, Debbie.
So I'm going to talk a little bit about Greenshield Plus, which is sort of my parent company, if you will. It's a first of its kind digital health and benefits ecosystem that offers unprecedented levels of integration between health services and benefits plans, all sort of in one easy to use place. So this has just started this year. It's where employers and employees can access all their health care needs. It's modular, which means that the employers can add or take away as many services as they want to offer. And as you can see here, we have telemedicine, mental health, pharmacy, insurance. Basically, we provide better access. It's a one-stop shop. It's again convenient because of that. You can leverage it really anywhere, anytime, through the digital capabilities, seamless reimbursements, for example. There's better integration. You can, our various players and providers actually can talk to each other so that you can have a more holistic approach and better health outcomes. Really, we achieve this by offering preventative care, treatment, and leveraging data-driven insights. So if you're, curious, take a look, Greenshield Health, Greenshield Plus. And lastly, again, we are offering this webinar bundle. If you're at all curious, you just have to email webinars@inkblot.com, where we have, again, put together a pre-package of relevant topics tied to wellness days that you are entitled to one throughout the year, and it will speak to your employees and, again, that relevant wellness event in that month. So heart health, for example, mental health day, and we have relevant topics that will help your employees. And that's us.
Perfect. Thank you, Debbie. Moving forward, we have a couple of minutes left. So for everyone, these are the professional development credits. We'll also be sharing this in a follow-up email for everyone to record that. And then to finalize, we just want to leave a session open for Q&A. Feel free to drop your questions in the chat box. And I do see there, give me 1 second. There are a lot of questions in the Q&A, which we'll probably respond in a follow-up email. So let me just see. Gotcha. A really good question. What do you recommend to employees who are working in a toxic environment in their workplace but cannot leave the job due to the high rate of unemployment? Debbie, Kevin, Catherine, any comment to that question?
That's a very loaded one to tackle. However, wondering if there is a way for that employee to go to HR, if there is somebody safe there to talk to about the concerns, they should be voiced. They could also consider speaking to other employees that are in that same environment, like the same team, if they can band together. Often it is also looking at how can they take care of themselves. If there is such a situation that they cannot change the workplace, what can they do to manage themselves and take care of their needs outside of that? Sometimes we get really intertwined with what's going on in the workplace, and that consumes us. But speaking sometimes to a therapist even, or a coach, or maybe a friend might be able to help them separate and take care of their emotional mental health needs versus being able to change the workplace. But again, if there is change that needs to be had, HR is a good place to start. If there is a safe manager or supervisor that they can speak to about their concerns, or speak to others to gain some traction. And I welcome the others to input what they might suggest.
I think on top of that, a lot of employers have anonymous feedback functions, and I think managers know and leaders know, especially of organizations, that people tend to leave managers, not companies. So to the extent that there are more people who are having this experience, it's likely due to a manager or maybe managers up the line. I just think to the extent that you have access to some anonymous feedback, that's a great way to do it in a way that feels safe. But specific feedback is really important. It can't just be like, oh, this person makes me uncomfortable, or you have to have very specific reasons, things that are actionable, and I think explain what is creating that feeling in that culture.
Yeah, I would just support Catherine and Debbie on both their comments. I think it's if there is a safe person, you need to get to that person, because a lot of organizations aren't even aware that it is a toxic environment, right? So they may not even be aware. So, is there HR or is your superior that you can go to confidentially on a confidential basis and just talk about the issues? Because again, management may not even be aware that it's a toxic environment. They may think they're doing a great job, right? You're on mute.
Sorry, I'm going to have to end the webinar. It's going to end automatically, unfortunately, but thank you everyone for joining. We covered a lot. Debbie, Kevin, Catherine, pleasure hosting this with you guys. Thank you for all the feedback, and we'll be following up with an email. Thank you, everyone.
Have a healthy day.
Thanks.